SERC offers different programs, and both Knowledge into Action project and our Selves, our doctor's program, have some similarities in a way that they both work with African newcomers in Winnipeg, and they both have components on increasing knowledge and increasing capacity among community members, and also to share in sharing knowledge with service providers here in Winnipeg. Our Selves, Our Daughters program is completely based on community consultations, and the terminology was one of the main concerns, because when we started to talk about with the community, we learned from them that expressions like female genital mutilation, that is used around when other organizations address this topic, is very harmful, because it's already judgmental when you say mutilation. So we learned from them how they would like to refer to these practices in a respectful way. They let us know that they felt comfortable by using female genital cutting, and that's the one that we use. So we use FGC. And in our Selves, Our Daughters, we never assume that people who come from determinate communities or determinate countries were directly affected by FGC or went through that. So we always say that we are working with FGC affected communities or FGC affected women's. So they are affected somehow, maybe somebody from their families went through the procedure, or some friends. So when we call people from our sessions, we are not inviting people who went through FGC. We don't know, this is private. We just are inviting people who might have in their social life affected by FGC.
Female genital cutting is practiced in different parts of the world, in some African countries, some Arabic countries, some Asian countries. Women who are affected by FGC are migrating to different parts of the world, including the North America, Canada. It is important to address FGC since that is the reality of the Canadian population as well. The objective of our Selves, Our Daughters project is to work closely with women from FGC affected communities and allies in the community to increase understanding and support on health and socio-cultural situations of the women who are affected by FGC, and to address also the prevention of FGC in the next generations. We know culture change takes time. It needs the involvement of the whole community. Because of that, we try to engage community leaders, women, and the community allies in a way that facilitates change, and in a way that facilitates also accessing services for women who are affected by FGC as well, and also in a way also that helps also to prevent also FGC from happening to next generation. And also when we come also to FGC discussion, also it creates fear or discomfort, because also FGC is illegal in many FGC practicing countries and also in Canada. So you have to create first like a safe environment to discuss the FGC, and it like to develop trust in a safe environment also it takes time. Every year we have 3 series of sessions, each group for 10 weeks. Women come to a closed group discussion. We try to create a safe environment on a place where the women choose. We have also youth sessions, youth girls and youth boys sessions. The youth girls session go for 4 sessions, and boys also go for 2 sessions. We have also men sessions that go for 2 sessions. And our sessions are set to address also holistic health information that includes also FGC. So like, for example, we discuss women physiology and anatomy. When we are discussing women physiology and anatomy, we discuss types of FGC. When we are talking about pregnancy and childbirth, we talk also about possible impacts of FGC on women's health during childbirth. So like we integrate FGC like in different topics in a way that creates also dialogue and discussion, and also relevant also to women's experience and life scenarios. We also have a service provider session. We share our learning from the community sessions to the service providers to promote also culture competent approach for women who are affected by FGC. We have more than 2 workshops with service providers per year.
We have people who have done this program. They are pioneers, ambassadors, and then we also have the materials, like in first language materials. So if those who do not come to the session because of some reasons, they can see the materials. And then we have also advocacy still going on. There are also volunteers who finish from this program, still helping other women internationally, and here in Canada, also outside Canada, because people have understood that FGC is causing more harm than good. People are doing it because of cultural thing. Our main goal is to achieve, one of all is to be advocates, like we are doing advocacy. We try to do away with the stigma and the isolation and the cancel culture kind of. And we want to know women to be comfortable and comfortable with their health, comfortable with the genitalia, comfortable with whatever is going around their world. They have to process it. So by the end of the day, we want this woman to feel that she is just a woman like any other woman, like nothing is missing in her life.
We try not to do assumptions that are so harmful from the African communities in Winnipeg. We learned, for example, that from many community members that many of them are not traumatized by FGC itself, but once they arrive in Canada, they begin to be traumatized by the way they are treated here by healthcare providers. We learned not to assume that they are considering themselves as survivors. We learned not to assume that just because they came from the terminated country, they went through FGC. The main learning is that they just wanted to be treated as anybody else and as human beings. We also learned from participants that it is very wrong to assume that just because people went through FGC, they would do the same with their daughters. And once they have information and accurate information, they can take informed decisions about their family, and they are trying to do the best. The more you blame people and punish people by things that occurred in the past with them, and sometimes they were children, they had no control about that, you are not helping at all. We never put ourselves in the position of savers. We are not saving. We are providing some information, learning from them, and providing this safe space so they can reach their own conclusions. The intended outcomes of our Selves as Our Daughters program are basically we want to observe that participants present increased knowledge about FGC and the possible health effects. And we also want to observe increased capacity for them to make a change in their communities. There is another component of this project that is working with service providers, and the outcome that we expect to see is that service providers in Winnipeg have more knowledge to create a safe space and a culturally appropriate space. We measure the outcomes through predefined indicators, and we use different evaluation tools. So most of the indicators, they are measured through a focus group at the end of each series. So the final session has like a time that is already reserved for the focus group. All the group is already expecting for that and prepared for that, so we don't break the safe environment that is created. Basically, they say what they learned and how they are going to use it and how meaningful it was or not, and how we could do better if they felt safe, what contributed for them to feel comfortable or not. So we can have feedback on how to improve the program and also know if we are reaching what we are expecting. Besides, we also have daily feedback forms in which basically the participants say if they learn new information, if they think they will use the information in their lives. Very brief and very short. Many of them don't speak English or have or literacy or English barriers to feel a written thing, so it is very short. We don't expect to receive qualitative feedback through that, so we leave for the focus group. For ourselves as our daughters, we have also an evaluation for service providers, and it consists basically in a written form that they do at the end of the session, and the most meaningful indicator for us is they stating if they have increased knowledge. The form for service providers, it has a scale to measure increasing knowledge for 4 points, which means the first one is no increase and the last one is a great increase. So we can measure, and we expect that at least 75% present considerably or great increase. What I hear from participants is that we never had this information before. We never had a safe space to discuss that before. It's taboos among many communities, and sexuality is a taboo, so nobody talks about sexuality. When people say that they never had this opportunity before, it is something that really shows us that we are on the right path. Also, when people tell us a thing that was not even expected, we are a local organization. We expect that people can act here in their communities, and when we hear from them that they are already sharing their knowledge with people in Africa, it is very meaningful for us because they are already doing much more than we could imagine. And they say like, oh, if I knew that before in Africa, I could have made so much difference there. Why don't you go there? Why don't you send the facilitators there? And so you see how the need is so urgent and so important, and the impact in awareness that we're doing. This can be implemented for any community. If you go there and you really try to understand from their lenses what is meaningful or not as a savior, but as somebody who wants to work with them to build based on what the community feels and thinks, and respecting their feelings, their stories, their perspectives. Because if you're going to offer a program, especially about knowledge, you have to value previous knowledge that people bring. So you have to start from that. Especially with newcomers, there are lots of programs that are very top-down, and that's why people might not feel respected just because they are judged, or there are so many assumptions based on myth or stigma. And so when you call people and ask them to bring their issues, and then you design something to meet their issues based on how people think we should approach that, I think this makes a big difference.